Good afternoon, everybody, and thank you for joining Courier and 314 Action's timely discussion on MAHA, the MAHA agenda, and Trump and RFK's healthcare policies and how they're impacting all of us negatively, especially as we're approaching the midterms. If you're not familiar with Courier, it's one of the fastest growing local news networks online across the country, has 9 million online subscribers, and a network of soon to be 20 state newsrooms, again, across the country. It's rapidly expanding. And I have had a really unique opportunity to work with the Courier team just over the last year on a lot of its healthcare programming. And I've seen it firsthand. They do really, really important work. And they're active across multiple domains, not just healthcare, but really every single issue, breaking news, politics, geopolitics, especially this moment that we're living in, and of course, healthcare. They are really at the leading edge. So look into Courier, look into 314 Action, especially after this panel. And what panel, we have quite the panel in store for all of you here on MAHA and the midterms, which I'm excited to really dive into. First, I want to introduce myself. My name is Dr. Vin Gupta. I'm a pulmonologist, and I see patients actively here in the Pacific Northwest. I come from a military background and have been involved in a lot of our healthcare policy debates for many, many years now. And what we're seeing basically in the clinic and hospitals across the country is emblematic of these broader discussions that I know our panelists, a very distinguished group of panelists, are going to be talking to all of us today about. But these interactions with patients, the stressors that patients and families are experiencing literally every single day, it's getting worse, especially over the last year. It's getting a lot worse when it comes to affordability of healthcare services, whether somebody can get a basic preventive screen for cancer, whether somebody can afford the next novel chemotherapeutic agent for their cancer. All these are challenges that we're seeing more and more across the country. We've lost 24 million people have lost affordable healthcare insurance because the subsidies expired for an affordable health insurance option at the beginning of the year through the Affordable Care Act exchanges. So we're seeing many millions of people now a lot more vulnerable than they were just a year ago. We're seeing, frankly, far more in the way of insults to the environment and the impacts it's having on our health through the EPA and the gutting of the EPA. We're obviously seeing significant impacts to basic science research and the NIH, which will have generational impacts. You know, I say this as a physician, we rely on the NIH and the scientists that are employed by the NIH to do work that requires years of guaranteed funding to ensure that we have new therapeutics, new antibiotics, new chemotherapeutic agents for cancer 10 to 15 to 20 years down the road. Those investments happen today so that we have the tools that we need for our patients in the next decade to 20 years from now. That stuff happens now. And we're losing scientists because they're seeing what's happening with funding. We're losing great talent because a lot of people are getting their PhDs now, not in the United States, they're going elsewhere. And so we're going to be diving into a lot of these issues with a phenomenal panel. We're going to be starting out with Hank Green, who I'm going to be bringing in just a moment. But really the purpose here is to begin a critical conversation. We're into the beginning of 2026. Healthcare is being attacked from all fronts. It doesn't feel like we have a lot that is optimistic or hopeful when we think about just the broader concepts of healthcare and a lot of the policy debates that we're having today. But the point here is hopefully to give you clear advocacy, talking points and ideas to motivate local engagement in your communities, to hopefully make sure that we're talking with a unified voice on issues that matter. And so that's the point of this conversation. But I want to start out. The way we're going to do this is the first 20 minutes are going to be me and Hank Green, who many of you know, leading science communicator here in the United States. We're going to be going back and forth. Hank's going to be giving us his perspectives on a lot of what we just talked about. And then we're going to be bringing in additional panelists for the bottom half of this panel. It's going to be about an hour long. And I'm really glad that you're here joining us for this important discussion. And so without further ado, I'd like to bring in Hank. Hank Green started making YouTube videos in 2007 with his brother, John. Now he's a go-to internet science guy, having produced and hosted literally thousands of videos and podcasts all across the internet. Hank is also the #1 New York Times bestselling author of the science fiction novel, quote, an absolutely remarkable thing, and also A Beautifully Foolish Endeavor. He co-founded Complexity, which produces SciShow, a crash course, and nearly a dozen other educational YouTube channels. His love of the online community prompted both Hank and John to co-found other endeavors, including VidCon, DFTBA.com, and the Project for Awesome. Hank, thanks so much for being here. Got any of that wrong, let me know. I think we're about to bring in Hank, but Hank, did I get any of that wrong?
No, you got all of it right. Good job. Thanks for going through the whole thing. I don't know. I apologize for sending you so many words to say.
No, it's great. I mean, obviously, Hank, your work speaks for itself, and many of us already know it, and all the impact you're already having. But I am curious, you've been there for the origins of science communication on the internet. You've been likened to Bill Nye in that respect. And I'm wondering, what are some of the tactics that you're finding are most effective in fighting back, or in really addressing this flood of falsehoods when it comes to basic health and medical information? What do you find actually bridges the gap and works versus just contributes more to the noise?
I mean, I think that I should give us all some grace and say that it's hard. It's a very difficult information environment. This is a somewhat typical thing that occurs with communications revolutions. I can't see Vin Gupta anymore, which makes, I can't see. Thank you. Bring him back. I want to see if he likes what I'm saying. It is a hard environment to communicate in. When you have communications revolutions, it tears everything apart. And then we end up in a situation where, people who are doing the thing that gets the most attention are the ones who feel the most real and the most authentic. And it's hard to get the most attention when you can't say the most attention grabbing thing because you have some allegiance to truth. So I can't get out here and be like, and we can, we're getting ammunition now, but I can't come out and say like, the government is poisoning your children. This thing that you thought was very good is actually very bad, and your children are going to suffer for it. And all of the ills of today are caused by the things that we used to think were good, and it's being done to you by a shadowy cabal of elites. I can't say that because it's not true, but RFK Jr. can, and he does, and he says it a lot. But I can now say that if we follow, and I could say this with evidence, that if we follow the ideas of RFK Jr. and we don't give our children measles vaccines, then there will be giant measles outbreaks in South Carolina. There will be kids who are like infected before they can even get a vaccine because they're too young when they're 6 months old, and then later they're going to die of a complication because the people around them weren't vaccinated. We can say these things now because they're literally freaking happening. So what I can say is that it does feel like maybe there just has to be like some antibody reaction here where we have to have a little bit of time. But then above and beyond that, I can tell you what doesn't work, which is just being mean and like fighting about it. And like, of course, that's the thing that is like most rewarded by the systems, and it's the thing that is most exciting and engaging to actually do. And nobody gets rewarded for having like complicated, nuanced, careful, thoughtful discussions, except in the doctor's office. That's where those conversations happen. And like, thank you to all the doctors for having those conversations where you listen to your patients, you hear their concerns, you give them like face to face, you give them that time, you ask them where they get their information, you talk about where you get your information from. And like you bring that humanity to it. And that's so hard to give, even in situations that are seemingly designed for human interaction, a doctor's office. But nowadays, it's so, there's so much competition for that time that it can be difficult to do. But that's like the place where I see it being done the most well. I go to my mother-in-law's oncology appointments with her, and I see the way her doctor talks to her, the way that he asks where she gets her information, the way that he like leads her through her treatment plans. And I just feel like that's like where it's being done the best. And that's what gives me a lot of like hope, like just like seeing it in the real world.
You touched on a lot there, and I want to make sure we get to
Get to all of it.
well, because I know that you've been a patient and you're willing to talk about that experience. So I want to get there in a second.
Yeah.
Recently the Annenberg Center at the University of Pennsylvania, I think about a week ago, published survey findings sampling 1,600 adults across the U.S., fairly representative sample, and asked them who they trusted when it came to just basic health information, sort of an overdue survey.
Yeah.
And it mirrored exactly what you said, which is about 86% said they were very confident or somewhat confident of the information they got from their own medical provider.
Right.
All the way down the list, at the very bottom was our current health secretary, RFK Jr., at like about 40%. So almost double the increased amount of confidence in one's own medical provider.
Still an astonishingly high number.
Still a high number. That's what I thought too. I'm wondering how we reconcile that fact with, say, the current nominee for Surgeon General, Casey Means, MD by training, has the letters behind her name, not a practicing physician, is not having those conversations that you just mentioned. And yet it seems like her currency, just like Mehmet Oz's currency, just like RFK's currency, is to tell docs like me and my colleagues that we're uppity experts, and the term expert and the fact that we're an establishment MD, if we're just comparing MDs, that somehow that's a strike against us. And so I wonder how we reconcile the fact that there seems to be this phenotype of individual that's anti-establishment, anti-expert, with all the same similar credentials to some degree, running and being rewarded for giving folks like us a lot of grief for doing quote unquote mainstream things. How do you reconcile that with the results of the survey?
I could give you two answers to that question. I'll give you both of them. One is that right now we are in an information economy that rewards above all the ability of someone to get attention. And Dr. Oz is very good at getting attention. He's proved that over and over again. RFK Jr. is very good at getting attention, and he believes that he deserves it very deeply. And he believes, I've studied him. I've read a lot of his work. It's interesting to do. And I think that he believes his stories that he tells. I'm trying to avoid language right now. And so there is that piece of it where right now what is being rewarded is being good at getting attention. And that I didn't say like people liking you. I said getting attention. And he we're talking about him right now. So he's good at getting attention even from people who don't vibe with him. And then the second thing I'll say is that the Surgeon General, Casey Means, was not voted on by the human population of America. What happened was the fraction of the electorate who votes Republican, and then the fraction of the electorate who votes in the Republican primaries, and then the fraction of the people who vote in the Republican primaries voted for Donald Trump. And then the Democrats made a bunch of ridiculous decisions and put up a real mess to sort of against that threat. And in like sort of not having the conversation with President Biden sooner, in not deciding to do a primary, like these were human decisions made by humans that I had no control over. And I feel like this was that's like the story of how Casey Means happened. It's like we got Donald Trump. And Donald Trump was like, we need to ally, like, I will happily align myself with RFK Jr., even though he doesn't care about RFK Jr.'s perspectives, and will happily like say, we need to make more glyphosate and put more glyphosate on the crops, which I think is fine. Like, I don't think that glyphosate's poison. I think that like we need to study it and make sure that it isn't dangerous. But like RFK Jr. does. That's all he talks about. That's what like people, when you ask them what they're actually concerned about with health, it's like chemicals, which is like, I don't know what you mean by that, but chemicals. And then it's too expensive. And the pharmaceutical industry is like corrupt and nasty and plays patent games, which are just true things that everybody should believe. And also that we should eat healthier and exercise, which doctors apparently haven't been saying to you for the last 40 years.
Right.
I think that like when you look at the controversial pieces, what's happening is that the people who are succeeding in politics right now are just very good, especially national politics, I should say. This isn't this case locally. In national politics, these are people who could get attention. And there's nobody who can get attention like Donald Trump. There's nobody who can get attention like RFK Jr. And so that that's what they're aligned on. Like that, like what do those two guys have in common? Not a lot, but they're good at getting attention.
And Casey Means and Kayleigh Means they're good at the same exact thing. I want to one more question on this, and then reflect on your own experiences with American healthcare more directly. It strikes me, I really have a hard time with some of the contradictions in MAHA, and I we're going to be talking about this for the broader panel shortly. But wanted to get your take on this, Hank. We are so willing, or seemingly the administration and then the American public more broadly, is very willing to accept these new class of weight loss drugs, the GLPs, as something perhaps that maybe everybody to some degree may benefit from, but certainly a pretty big denominator of Americans. Trump RX, 43 medications, has gotten a lot of print. 43 medications, there's tens of thousands that exist. Most of those 43 medications on Trump RX are some version of the weight loss drugs. So they've wrapped their arms around this. I think we could also hopefully agree that very promising, a lot of potential great clinical outcomes, but not nearly as well studied as, to say, the measles vaccine. Yeah. Something safe, effective, studied for decades on the safety profile and efficacy profile. And so when we think about the core organizing principles of MAHA, one of which is don't put a lot of stuff in your body that's organic or inorganic and man-made, pharmaceutical. Why is it that we're embracing, or MAHA seems to embrace, a GLP, less studied, costly, maybe a litany of side effects, bone mass loss, muscle wasting, you name it, and yet they're very against vaccines? I recognize there's an ideology here and there's maybe simple explanations, but it seems to all fall down when you see that they're embracing one therapeutic that's expensive, tons of side effects potentially, we just don't know. And when it comes to the measles vaccine, it's an easy target, but seemingly for the same reasons that you would think the weight loss drug would be. I'm wondering how you reconcile one of seemingly many contradictions. How do we wrestle with that?
I mean, I think that I think that you are looking at it in a way too abstractly and in a way too specifically. So the way that I understand this is simply like, what will get people to, I'm sorry to keep harping on this, pay attention to you. And if there's a new miracle drug that's interesting, and for clarity, I do actually think GLP-1s, like from the data I've seen, amazing drugs, very useful for a lot of people. And I'm very glad that we have them. That like a new miracle drug that is created and, like, we don't have a lot of experience with it. It's just like and I think that there is some traction to the folks who are sort of anti-GLP-1. Like we've heard that backlash start to happen now. But this is sort of more like a cycle of excitement. Like, you couldn't, back in the day when measles vaccines first came out, you couldn't like be against measles vaccines because they were such an obvious good. And now you can, because like there's a vibe that like wait a second, is this actually, like, it's just like, which stories sound good?
Right.
I think is like I've read so much RFK Jr. that like that's really what feels like it comes out more and more to me. And then the other thing I'll say is I don't think that MAHA is pro GLP-1. I think that Donald Trump is. I think that RFK Jr. has been like tremendously, honestly, like a great deal of damage has been done. Don't get me wrong, but I think that like ultimately there's been a lot of like defanging, because it was never about like Donald Trump agreeing with any of this. It was just about like, let's, whatever portion of Americans, like, RFK Jr. doesn't have a lot of fans, but his fans are very diehard. And so he's going to get all of those people if he Kamala could have done the same thing. And in fact, RFK Jr. offered it to Kamala before he offered it to Trump. But like, of course, who would make that deal? Not me. So, so I don't know that that's actually the case. I think that MAHA is, in many ways, it is kind of the dog that's caught the car here, and it can't actually do a lot of what it wanted to do because they're all very bad ideas, except for the things that everybody agrees about.
Right. Hank, as we're coming to a close before we bring our panelists in, I do want to make sure we have a few minutes to talk about your own personal experience with American healthcare. It does strike me that what MAHA is very good at, you're right, they're very good marketers and great. MAHA's a great marketing slogan, not much substance. They're great at attention. And it seems like they weaponized everybody's annoyance or angst or anger, frustration, whatever you want to call it, with the American healthcare system to some degree. It's frustrating as an experience. Therefore, they're going to harness it and say that they're taking on Goliath here, this healthcare industry. Can you reflect on your own experiences and the ways in which maybe that is true, and perhaps where should we be focusing on to what are the conversations we're not having that we should be having?
Sure. I mean, I think that there are little things. There are things about the incentives that pharmaceutical companies have. In cancer, you'll start to look into cancer research, and there's a lot more incentives to make a slightly different version of the same drug than there is to actually develop something that's new or goes after a new target, or for a bunch of different reasons, the greatest of which the chances of failure are much higher, and that it's expensive. So and this is part of why the NIH is so important is we fund these things before in times and ways when the private sector has no incentive to. And so when you look, this has always been so interesting to me that we talk about what are the incentives. Of course, the cancer industry doesn't go after all of the cheap ways to treat cancer, but the cancer industry, the people who are doing the primary research on potential new treatments are not pharmaceutical companies. They do a little bit of it, but mostly it's universities being funded by the government. And so they're incentivized to do the things that have the most impact. They're not incentivized to do the things that are most expensive. But anyway, that's just me. But in terms of what pharmaceutical companies want to develop, there are a lot of perverse incentives there. I think we should push back against it. I also think that we have ways that we push back against it. They just are not celebrated. And then in terms of the experience of a person inside of the system, it sucks. I had the best possible version of this in 7 different ways. I had a very old cancer that has old treatments, and I took all vintage chemo, stuff that people have been taking since the 70s. And so it was quite the most expensive part of my treatment with scans, not the drugs. But if I had to take it for longer, one of my drugs would have switched over to a new one that would have been $13,000 a month. And then my insurance would have covered most of that, but it's wild to go from my entire chemo bill being $500 a treatment to being suddenly $7,000 a treatment.
Right.
And so these things make no sense. And the incentives are very weird. And so you can't be surprised when people are doing weird things. So you have to change the incentives. You can't let people get away with creating a treatment that extends extends average life by a month, and then being okay, well, that's going to take the treatment cost from $50 a pill to $13,000 a pill. That is not how that works. And they're it's all weedsy, this. It's all a bunch of little incentives, little changes, and maybe the bureaucracy has been built up too much that now it does need a little bit of we need to weed whack this and rethink it in a really big way. Maybe RFK Jr. is right about that. I don't think that he's the right guy to do it. Maybe you are. I think that I do think that somebody needs to get in there and make some enemies. That's how I feel. You're not going to be able to do this without making enemies, because a bunch of people are making a bunch of money. And that's not just the insurance companies. Doctors in America make more than they do in any other country. Nurses in America make more than, not depending on the kind of nurse, make more than why did we choose anesthesiologists to be the one who makes $1 million a year? I don't get that. Do you get that? Why? Vin Gupta, why did we choose anesthesiologists to be the ones who make $1 million a year?
Well, I also don't know the answer to that. I will say, and then I want to bring in, I want to continue to ask you to Hank.
Yeah.
What I want to say is we're going to have to do that with the full panel. I do want to quickly react. for our audience, at least, I'm a pulmonologist, and inhalers for some of the most common disease conditions in humanity, asthma, COPD,
Mhm.
cost a lot of money. And
Mm.
we've had generic versions of inhalers for many, many decades. And they don't have a lot of market traction, in part because pharmaceutical companies can add a small ingredient to an existing inhaler and keep it branded through
Yeah.
through a patent.
That feels so easy to fix.
So easy to fix, these patent thickets, and it just creates all these perverse incentives, to your point,
Yeah.
for companies to continue to do that. And we should eliminate those loopholes. But I want to make sure that we have our full panel join us. We're at the top of the hour. I will say to the Courier folks, since we started a little late, that's why I'm taking little liberties here with Hank. But I do want to bring in Dr. Mary Trump, U.S. Representative Lauren Underwood, and Shaughnessy Naughton, 314 Action President, to the discussion. I'm going to interview everybody with their honor and introduce them. Dr. Mary Trump. I'm big fans of everybody that's about to join as well. I love all your work. Dr. Mary Trump. Mary, great to see you. Dr. Mary Trump is an American psychologist and author of 3 books, including the international bestseller Too Much and Never Enough: How My Family Created the World's Most Dangerous Man, and 2 other New York Times bestsellers. Dr. Trump holds a PhD in clinical psychology and a master's degree in English and comparative literature from Columbia University. I'm going to do away with honorifics when we're having the actual conversation, but I do want to make sure I'm using them for the introduction. U.S. Representative Lauren Underwood. Representative Underwood, gigantic fan of yours as well. Member of Congress, a registered nurse. Congresswoman Underwood is also a public health expert serving in her 4th term representing Illinois' 14th congressional district. She made access to high quality, affordable healthcare her signature issue in Congress. You have a ton of fans in the medical community, so thank you for doing that. And she is currently serving in the House Democratic leadership as the co-chair of the Democratic Policy and Communications Committee. And last but not least, Shaughnessy Naughton, 314 Action President. Shaughnessy, you've done an amazing job with 314 Action. Thank you. Shaughnessy, president and founder of 314 Action, the largest national organization working to recruit, train, and elect scientists at all levels of government. She's a former chemist and drug researcher. So Shaughnessy, maybe you can help correct what I was talking about. Shaughnessy launched 314 Action a decade ago following her run for Congress to recruit STEM candidates and give them the tools and resources to win. For any STEM candidate out there, 314 Action's endorsement is incredibly meaningful. I've seen it directly with some friends of mine. So Shaughnessy, thank you for both being here and also helping to underwrite, support this event today. I know we have limited time, so I'm just going to get us all started here. I want to start, Mary, with you. Sort of building off the conversation Hank and I were just having. I've been wondering about this question. I think a lot of us probably have been wondering about the same thing. And so coming directly to you, could you speak to the relationship between RFK and the president, and whether it's based on political expediency, or is it this shared belief in pseudoscience or just alternative facts? And I say that because the president's talked about aspirin and how he wants to have thin blood, any number of things we can go into, which I won't rabbit hole. RFK obviously has been plus oneing a lot of these statements and policies. I'm curious, is this a shared belief system, or is it just political expediency playing out?
I think it's really important to remember. Well, first I want to say it's such an honor to be with you guys. I can't even believe I'm with you. It's really important to remember that every single relationship Donald has is transactional. He has no belief system whatsoever. His primary and perhaps only belief is that, and he's trying to convince himself of this constantly, is that he's the greatest, the best, the most amazing, the smartest. He knows more than the generals. He knows more than the doctors. And people like Robert Kennedy have figured out that the easiest way to get what they want is to make Donald believe that they can do something for him. So I think it's a mistake to give Donald any credit for understanding anything or having any beliefs, because that almost gives them the benefit of the doubt. And I think the problem we're facing right now is that because he is so easily manipulable, people as unfit and psychiatrically disordered as Kennedy can be in a position of real power to have massive deleterious effects on Americans' health, both physical and psychological.
That's so well said, and sort of tracked, Mary, with what at least I personally felt. Thank you. Lauren, I want to come to you. You know, it seems like what's frustrating about MAHA, and Hank was talking about this earlier, you're obviously living it and are in Congress, I'm sure feeling this as well. It seems like for every statement that I would expect the health secretary to be against, or policy, say the gutting of EPA and what it means for our air and water, NIH-related cuts, you name it. It feels like there's a SNAP cuts and healthy nutrition, just the focus on nutrition and medical education, and yet at the same time, we're going to defund SNAP. It doesn't make sense. Could you speak to the seeming paradox and how you, as a member of Congress, a leading health voice in Congress, are navigating this and bringing awareness to the seeming paradox that they talk a good game, they're great at attention, and yet the policies that they're actually advocating or putting out there, the administration writ large, seems to be the very opposite of their stated intention. Wondering how you're reconciling that.
Sure. Well, I think the first thing to remember, number one, is that they lie. They lie all the time. They lie really readily and easily. It doesn't feel like a lie to them probably anymore. And they are happy to advance whatever can help enrich themselves, can amass more power for themselves, more fame and more attention. Okay, so that's number one. I don't think we have to go deep into the psychology of this to just call a spade. And, you know, Robert Kennedy's a liar, Mehmet Oz is a liar, you know, they just are not credible voices in healthcare. Okay, second thing I want us to remember is the MAHA movement, MAHA moms, Make America Healthy Again, this like fake seed oil thing and all of that stuff. And the people who truly believe some of the nutrition claims are very different than the MAHA politics and the MAHA agenda that sometimes they try to move legislatively or administratively through regulations out of the department. And so I think of like the MAHA moms brought Robert Kennedy to the conversation, but he's not running for anything. And so they have really taken actions to alienate those folks, to break the promises that they made. They are no longer focusing on the core tenets of that Make America Healthy Again platform in order to continue to, one, please Donald Trump, and then two, advance their policy agenda. And so I think in the context of this discussion, right, we're in the business of winning elections. Because the way that we stop Donald Trump in this chaos is to win in the midterms in November 2026. That's how we are successful. And I would just encourage us to think of these folks who really care about nutrition, who care about food additives, who, you know, may have some questions about where their medicines come from, to think of them as listening. And it's up to us to extend that hand to them and talk to them about those issues that are most important to them, people that we would call a MAHA voter, right? They're not partisans. They really aren't. And they're up for grabs in these midterms elections.
Lauren, can you, just a follow-up there, I really appreciate that. Are there, for everybody listening that's trying to have a voice in these upcoming midterms, that wants to talk about healthcare issues, would you recommend us focus on certain topics that you think are really resonating?
Yes.
And staying away from others that might be a little bit more triggering? Wondering your guidance there.
I recommend people talk about lowering healthcare costs. Donald Trump and the Republicans in charge took $1 trillion out of Medicaid. They took $500 billion out of Medicare and refused to extend the popular Affordable Care Act tax credits that allowed 25 million Americans to get access to affordable healthcare coverage. And there's a real values misalignment when one party is in the business of raising costs and taking away care, and the other party is trying to lower costs, get rid of disparities, and expand access to care. And if we can keep the message tight, I know it's really tempting to try to litigate, fact versus fiction, to try to trot out the latest scientific evidence and all the rest. But we have to remember that the American electorate is literate at the 8th grade reading level. You know what I mean? People aren't in the weeds on all of these issues, and they really are looking for someone who's going to help them and their families advance financially.
Thank you, Lauren. Shaughnessy, hoping you can take the baton there. That feels like a setup for 314 action and your priorities. I'm wondering, how does a scientist, a doctor, a nurse, public health official, how does that candidate, and I know many that are running in this cycle, how do they help us, or how do they help move the country forward? And then how does that sort of speak to the broader mission of 314 action?
Yeah, well, I think Congresswoman Underwood just set a nice template for other science candidates to follow, is to call them out on their lies and to focus on the things that really matter to Americans. And that is the price and access to healthcare. People do, the MAHA movement promised, better nutrition and greater access to healthcare, allowing SNAP to cover healthy food for children. They did none of those things. Instead, they gave us weird Kid Rock videos and glyphosate exemptions from liability, when it's something that RFK Jr. has spent his career suing the manufacturers of glyphosate and enriching himself off of, accusations that it caused cancer. So I think there's been a real betrayal of the MAHA movement. And I would say the broader coalition that helped to elect Donald Trump in the 2024 election, they have spent the last year firing those constituencies, whether it's the Joe Rogan listener that voted for Donald Trump to stop endless wars, or the MAHA mom who wanted better food for their children. And so we need to, focus on that. The destruction they've done to the confidence in the vaccine schedule for children has been really devastating for parents. I mean, that don't know if their children are going to school with kids that haven't been vaccinated for things like measles. And you're seeing that play out in places like South Carolina, where we are having outbreaks and children are getting sick. And this is more than just a rash and a fever. There can be lifetime and fatal effects from measles. And so I think we need to really focus on what the failures of this administration have been, and the failures of the Republican Congress to actually provide any accountability, including by confirming RFK Jr. as the health secretary, and now, even flirting with the idea of confirming Dr. Means to the Surgeon General, when she wouldn't even qualify for the health services to work for the Surgeon General.
I'm glad you brought that up, because Mary, I wanted to come to you about this concept of optics and central casting that it seems like the president has always had a keen eye for when it comes to picking his people. I only say this as an observer, but could you speak to what seems like isn't in his? I know this might be too rational of a question, but it feels like he's very into optics in something like healthcare that is such a. It seems like optics has become a litmus test for people that are healthcare leaders. Do you look healthy? Are you healthy? Therefore, should you be giving me advice? Sort of the Rogan template for who he listens to or not, or who he doesn't listen to. It is, do you work out and do you look healthy? It doesn't feel like the president's following his own template on optics and the people he's surrounding himself by. And I'm wondering if you could speak to that, because it doesn't make sense, but based on kind of his view of the world, but maybe I have it wrong.
Well, it makes sense if you recognize that he's delusional, which he is. And I don't say that lightly. So if he has to convince himself on some very deep level that he's always right about everything and he knows more than everybody, he is going to make choices, again, that benefit him personally. He does not care about the greater good. He does not care about other human beings. And to Representative Underwood's point earlier, the advantage they have is that they are willing to lie and we're not. But what I'm hoping will finally start to happen is that they're going to be able to stop getting away with the lying when we get to the point where the lies are contradicted by people's lived experiences. It's one thing to lie about the efficacy of a safe, readily available vaccine if in the abstract you have never had anybody you love get very ill with measles, for example. It's a completely different issue when people start getting sick, people start dying unnecessarily because of the lies they're being told by the people in power, who have a vast sway over many Americans because of how information is siloed. But I think we're getting to that point in terms of the war in Iran, in terms of the economy, in terms of Americans' health, where people are seeing that it can't possibly be true because they're getting sicker, they're getting poorer, and they no longer have access to the kind of healthcare that is going to keep them healthy at the most basic level.
Lauren, Representative Underwood, I'm going to switch between honorifics, I guess, because I feel bad.
Don't worry about it.
Using them. I want you to just pick up from where Mary left off. And you're a nurse by training. You're talking about simple messaging to cut through the noise. Can you speak to? I want to take maternal mortality as maybe a frame here. We have one of the highest rates of maternal mortality in the developed world, especially given the fact that we pour so much resources per capita into healthcare. Could you take a concept like that? I know you're focused on many issues in health and in American healthcare, health equity being one of them. What's driving that? And what are you working on to address it? And how do we message on that in a way that actually can help people realize, well, gosh, there's one party that's focused on solutions. The other is focused on sort of pulling the rug over our eyes.
Sure. Well, I work a lot on ending preventable maternal death in this country because the United States leads the industrialized world in maternal mortality. Black Americans are more likely to die. We're 3 to 4 times more likely to die than our white counterparts. And one of my good girlfriends that I went to graduate school with died 3 weeks after delivering her first child, a beautiful baby girl, in 2017. Now, my friend, her name was Dr. Shalon Irving. She was working at CDC on health disparities projects. And I remember going to her funeral where the director of the CDC stood up and spoke and was like, I don't know how this could happen. And I was like, what? We know exactly how this can happen because it's been happening for decades, this disparity in this country. And, 80% of maternal deaths in the United States are preventable. Now, what we have seen is in the last several years, there's been 3 kind of catalyzing events: COVID, and what happened during the pandemic, systematically denying pregnant and postpartum people access to the vaccine and treatments, the Dobbs decision. Right, those states that have enacted partial or total abortion bans have seen their maternal death rates increase, and also severe complications. That's what we call morbidity, severe, and then maternal mortality. And then obviously these Medicaid cuts that are looming would be this third blow to maternal mortality in our country. So I co-founded the Black Maternal Health Caucus, and we have written a comprehensive bill called the Momnibus. Say it with me, Momnibus. And Momnibus, yes, is a play on words. It's takes the legislative word omnibus, which means big bill, but it's for moms. And so it's called the Momnibus. 14 bills in one, and it addresses every clinical and non-clinical factor contributing to preventable maternal death. We've had some of our Momnibus bills signed into law. We've had hundreds of millions of dollars in key Momnibus priorities gone out to communities over the last several years, and we're preparing the full bill for reintroduction this Congress, where we're going to work with our colleagues on both sides of the aisle to advance the whole package.
And can I just hop in here for one sec?
Please.
I mean, like Congresswoman Underwood really embodies why we need to elect more scientists and nurses and doctors to Congress and elected office around the country. Black maternal health has been devastatingly worse in this country for centuries, and no one had made it a priority before until she got to Congress and co-founded the Black Maternal Health Caucus, which turned into a bipartisan, bicameral caucus that is pushing this omnibus through Congress and improving health outcomes for Black women and mothers throughout this country. And it really does speak to why it is so important that we have diversity of experience in Congress. When we started 314 Action, there were more talk radio show hosts in Congress than scientists and engineers. And we have definitely chipped away at that, but there is a lot of work to do. And I think particularly around these MAHA voters this year, there's a real opportunity to bring them back into our camp, because there is a genuine concern by a lot of Americans that there are unhealthy things in our environment, and this administration is making it worse. There is a genuine concern that there is unhealthy food in our food supply, and this administration is making it worse. And there is an obvious concern that healthcare is unaffordable and unaccessible for too many Americans. And this administration and the Republicans in Congress are making it 10 times worse. And so it is so important that we listen to voices like Congressman Underwood and a lot of these doctors and scientists that we have running across the country.
Okay, thank you, Shaughnessy, for stepping in. I actually want to pose this to you and then to all three of you, actually. Hank and I were talking about the information economy when it comes to what breaks through the algorithm and goes viral, which seems like that's a currency of power unto itself. When you think about, I think about the role I play in public health communications, and there's a lot of abuse one gets whenever you're talking in scientific fact now on X or whatever it is. And I'll have conversations with colleagues of mine that are not used to getting the same level of abuse, especially if they're fellow physicians, whatever it is. We're just not. I don't think that's our makeup when we're going through graduate school and caring for patients. I guess. Could you speak to the potential prospective candidates out there, Shaughnessy, that might be a 314 Action get an endorsement down the road about the world of running for office and preparing yourself for scrutiny and potentially getting negative scrutiny? And because it feels like the path of public, sort of being in public office, that's the most foreign to that group is getting negative scrutiny. But I'm wondering if you're finding that to be the case.
Well, sure. I mean, as you might know, I was a chemist and I ran for Congress. And that's part of what started 314 Action, was realizing how few scientists there were in Congress. And one of the first things that the advisors told me was to stop reading the comments section and on any article that you're referenced in. But just because the loudest and meanest voices in the room are present doesn't mean that they represent the majority. And we saw that in the Annenberg polling that was released last week, that overwhelmingly among the top professions in the country that people trust the most are scientists and doctors and nurses, sometimes even more than the military. And and I think it really speaks to the moment and the challenge that we have with this perpetual liar in this, leading this country, and a lot of the cabinet secretaries, is that people really are looking for truth tellers. And that is what scientists and doctors and nurses represent probably more than anything. And their credibility does extend beyond just their field of expertise. Nobody brings their child to a pediatrician that they don't trust, and they trust that pediatrician to recommend food, to tell them what they should have and shouldn't have in their house, as far as what could be dangerous for their children, and also on their vaccine schedule and medication to take. And so I think it really speaks to that wraparound trust that people have in scientists and health professionals, and a real opportunity for us to not let the perhaps those loud voices shouting down scientists and health professionals take over the conversation.
Mary, can I come to you with the same question, maybe slightly revised? You're so good at breaking through the noise and delivering a clear message. I feel like that's hard to do sometimes in a 30-second soundbite in medicine or public health. And I'm wondering if you can give us some best practices or advice.
Yeah, I think we need to start holding accountable the people who are enabling all of this. It isn't just Donald Trump. It isn't just Robert Kennedy. It is an entire system that is allowing them to do such damaging things to the American people. And I concur that we need more. There's been a war on expertise for decades. So it doesn't help, of course, that the only medical doctor who is a senator on the Republican Party also voted to confirm Kennedy. So, but that's perhaps a story for another time. I think we need to help people understand that what they're dealing with in terms of trauma from COVID that's never been addressed, in terms of the fact that our air and water are getting more polluted because of Republican policies, lack of access to healthcare, et cetera, et cetera. It's all being done intentionally. And the people doing these things need to have their feet held to the fire, and they need to be made to answer for these policies. And we need more bipartisan initiatives like the one Congresswoman Underwood initiated, because I think we are beyond politics and policy on what is going to make our lives better, to improve the quality of our lives, and to make sure that we start caring for each other, because that has fallen out of fashion. And I think if we can speak to people at that basic level of humanity and remind them that the way we get to be healthier is to be more compassionate, empathetic, and kind.
Love that. I love that. I'm going to be coming now, Lauren, to you, and then Shaughnessy, I'm going to give you the last word here. Lauren, can you did this a bit already with some of your work addressing maternal mortality, which I mean is inspiring, and I think I agree with Mary that that's the type of framework that we need to be talking more about. I'm wondering if there are other initiatives or systems being built that can give us all optimism that if we can vote for the right STEM candidates, if we can mobilize people on issues of healthcare, that perhaps the future can look a bit brighter. Could you give us other examples, things that are giving you hope that you're seeing that maybe we're not seeing?
Well, I'm certainly optimistic that the American people are going to enthusiastically head to the polls. We have just started primary season, where we have seen turnout numbers that are extraordinarily high. Illinois is going to have our primary next week, and then so on. And that's a big source of hope and encouragement for me, not just with the 314 action endorsed candidates, but just across the board. People running for state legislature and county board, people running for a judge, people who have stepped forward, ordinary Americans, people like me who are nurses, but of other backgrounds and professions, and said, like, we have to lead in this moment and meet the urgency of the moment to save our democracy. I also think in terms of legislative initiatives, as we can be really focused on addressing this affordability issue, I think about affordability as an umbrella. Housing, healthcare, groceries, care economy, right? So childcare and elder care and the high cost of utilities, right? Gas prices are spiking. We have to have a direct conversation with the voter and tell them what we are going to do. So with healthcare, we're going to lower the cost of prescription drugs. There's no reason that we can't have $35 insulin for everybody, right? There's a lot that we can do to make sure that we're lowering the cost of each healthcare encounter, so that, you know, your copays and deductibles, which are spiking, you know, we can address that, and along with, obviously, the high premium prices that the average family can't afford, right? Like I think as Democrats, we have the opportunity to have that really focused conversation and not only talk about it in the lens of the harm that Donald Trump and his administration have caused, but also a really positive forward-looking agenda of what they can expect when we're in charge.
Beautiful. Shaughnessy, I want to give you the last word here. Why are we having these conversations? How does it jive with both 314 Action, your priorities, but also this moment for the country?
Well, I mean, I do think the MAHA voters are an important constituency to be talking to, because I do think we can win a lot of those back in the midterms this year. I think people are frustrated and exhausted with the politicization of everything, of the lies coming from this administration, the false hope that they give with promises of easy solutions to really complicated problems, and they've lost credibility with a lot of these voters that feel really betrayed. And I think there's a real opportunity for scientists and health professionals to step in and earn their trust and earn their vote. And you do that, as the Congresswoman said, by presenting a vision of the future that is optimistic, that is what embodies America, that we can solve these problems. These are not impossible problems to solve, but we need to put the right people in place. And we do that by winning Democratic majorities across the country, and especially in Washington this fall. And we do that by electing more scientists and health professionals.
Amazing. I got to say, I'm huge fans of the three of you. Hank, I thought Hank was joining us, but Hank, if you're around and watching, at least, the four of you are incredibly influential in shaping these debates and just in people's understanding of these issues. So thank you, Dr. Mary Trump, Representative Lauren Underwood, Shaughnessy Naughton, all you do for 314 Action. You serve such a vital role for the public commons, and we're grateful. I'm very grateful, just as a clinician. I will say, for all of our attendees, thank you for joining us. I hope this is the first of multiple programs that we can do together on this topic, especially as we approach the midterms. I also want to just, again, thank our incredible panelists for your statements, for keeping it just as direct and clear as possible to help guide how we talk about these issues in our own communities. I do also want to just urge everybody that's listening to follow all of our panelists, including Hank, on social, across their social platforms, Courier News, 314 Action on their socials. They are constantly pushing out, whether it's Courier and important newsy items across a range of issues. This quite literally digital breaking news in ways in which you can easily ingest it. Highly recommend that you follow Courier and 314 Action. I actually know who to support or learn about interesting candidates, especially in STEM fields, by following 314 Action across social platforms. So I hope you'll do the same. And again, this event is recorded. It's going to be available to watch on Courier's YouTube channel shortly. And again, thank you to 314 Action for helping to sponsor this, and for all of you for just being here. Thank you so much, and I hope that we could do this again soon.